could you please explain what is your problem?
Problem with my shoulder.
Okay, right shoulder.
It's a right shoulder, and I can.
You cannot put in the back.
Yes, I can, but it's painful.
Okay.
Okay.
Can you show where it's painful?
It's painful here.
In
It goes a little bit lower.
Okay. But now, I would. Anybody volunteer to be practitioner? Anybody? Sure. Are you okay for this gentleman to treat you? I'll supervise. Okay.
So it's the large intestine problem. Can you show me where's the...
Yeah, maybe you show one more time.
Well, it's inside the joint, but also here.
Yes.
It goes from here to here.
Okay. Do you see that? What
Can
is
you...
it? I think she show
put the
enough.
arm like this? Yeah.
What is your diagnosis?
It should be large intestine.
Yeah, and do you think maybe another one?
Maybe, yeah. It's here, oh.
No, here,
Yeah, here.
here, and going down here.
Okay. Well, maybe it's just large intestine. Oh, what do you think?
There could be a little of the lung. Here they're very close. Lung, large intestine, they're very close. Okay, so I would diagnose both, but you can,
Okay.
yeah, I would diagnose both, and actually I would maybe think about the lung more. But yes, so you can relax, sit back, relax, very good. Now, is there any other question you want to ask your patient before doing
How
anything?
much is the level of the pain? From 1 to 10?
4, 5, maybe. If I try to do this,
Okay.
4, let's say.
Right.
4. Okay, very good. Now, we're studying system 5. Do you want to use system 5?
Do you have a picture?
Okay.
Or maybe I can...
Yes, somebody has it. You can call a friend.
Okay, so we take the foot. A lung was liver, right?
Yes. So if you start with your diagnosis as a lung, how do you balance by system 5?
With liver.
Very good. Which side?
Opposite.
Very good. Now, what are you going to do? Very good. Yes, she's very good
Maybe
patient. Maybe you what?
I won't go for the hip joint, so maybe
Yes.
we can turn the...
Yes, we can reverse the image. I will explain a little bit later. Yes, we will. We can reverse the image.
Do we go by image now or by mirror?
Yeah, mirror. We can
Mirror.
reverse the projection. I'm sorry.
Yeah.
Yes, we can reverse the projection. I will explain exactly what that is later, but you see her arm here, right? If we project on the other arm, it's like that. But I can use this as a point of symmetry, and then I can do like this. So in this case, the shoulder is become the wrist, not only shoulder. And since the wrist is also ankle, then I can mirror the shoulder with the ankle. Okay, are you following me? I will draw this for you later. Okay, so very good. Okay, now where are you going to palpate?
Ist okay, alles bleib mal sitzen.
I just switch inside.
Where is it? Liver channel.
I'm just thinking.
Yeah, you're correct.
Yeah.
You were correct.
Do you take the ankle, right?
Yes,
Or
the ankle.
further distal?
No, it's for the shoulder joint. You go by joint.
So it should be somewhere here. Sorry, no. I think we
You
could
start
take this
gentle.
one.
Okay.
I did, and then I pressed.
What does Asher mean? When you press, your patient say, "Ah," you say yes. Okay, sure means yes in
Yeah.
Chinese. Okay, so yes, so you be gentle with the lady
I will do it.
in the future. You start slowly.
Yeah.
If no reaction, you can push a
I
little
did
bit more. Ah, okay.
And then I pressed and... But maybe too fast.
But it is
Maybe a
it
little
was
bit.
painful. That's
Yeah.
okay. Not because of you. Probably
Yeah.
that's the really right point.
Okay.
So your technique was like this?
No, not like this. You do your technique. If not
Okay.
something too quiet, I will
Was it
correct.
here?
Okay, don't do this.
Yeah.
Okay, it's not necessary to.
Yeah,
I'm
yeah,
exaggerating, but not necessary. You
I see,
break
I
the
see.
skin,
Yeah.
you
that's
wait, and then
And then
slowly
go.
you insert.
Mhm.
Okay. Okay.
Okay, can you move?
But do you think this is going to be enough? Where
No, I don't
was
think
where
so.
was her pain?
Going down.
Here and it was also going down.
Yes. So this is not for sure not going to cover enough.
But would you now let the patient move?
I would
After the
ask.
first meal?
I'm sure this is not enough
Yeah.
because it was really a big area.
Yeah. Yeah.
So I would palpate around this, looking for more ash. Before no, that's too
No,
far.
I'm looking for the.
Is this
TBR.
too far?
I know, and I was just looking for the bone
Ah, okay.
For
I'm
the
sorry. Yeah.
pathway.
Yeah. You're correct. I'm sorry.
Okay.
Mm-hmm.
Thanks.
Take your time and you just break the skin, gentle. Yes, stop, and then slowly insert. Now you can insert a little bit more.
I don't know.
Yes. No, don't do this.
I'm sorry.
Yeah, it's okay. I'm here to
Yeah.
correct you, but I don't know why. The schools they always teach you to do that. I don't know why.
Normally we do that
Many people do this, I find, but I don't know why they teach
right
this way.
To stimulate the point.
No.
Yeah, but
It's just a bad habit.
yeah, but I know it takes time
Yeah.
to change a bad habit.
Yep.
Yeah, this much better. Okay,
Very good.
I would go here.
Thanks.
I know why we do this to make the chi.
Okay, now you can ask.
Yeah. Could you move a little and
Not this.
tell us how the.
Can I put my leg down so I
Oh
can...
yeah. But I don't want. No, not this. No, you didn't instruct her correct.
Can you just move your arm just a little, like
Just like
turn
this.
it and
Yeah.
just.
You don't want the
little
patient
movements.
test immediately.
Yeah.
Just let them. Yeah, very good.
This is fine.
How does it feel?
Okay. Then
Okay.
she can test.
Super.
You see? Much better.
Ah, okay.
Yeah.
Okay. Then you can ask her where is your pain
Yeah.
now and how much if there is
Yeah.
remaining pain.
Do you still notice pain?
Maybe inside the shoulder, but not anymore here. Maybe a little bit.
Mm-hmm.
Maybe in between 1 and 2. That's
Okay.
really.
Mm-hmm.
Yeah, maybe a little bit
Here.
Maybe.
Yeah. You know why?
But not that much.
Very good. You can already give her 5. Give him 5 because he did great job. Congratulations, and you deserve a clap too. Okay. Now I just want to tell you something. When she says there is maybe remaining pain inside, is you need to go inside the joint.
Yes.
So I will do more. So this
mean
needle.
deeper?
Let me see if I yes.
That's not.
So you can puncture the joint?
Yes, of course.
Oh, of course.
Why not?
I don't know.
Then you tell her move again.
He wanted to do that, but I stopped him. So
Yeah.
No, I
Right.
didn't.
yeah. You were going, and then I said that was enough.
Yeah, you tried. No.
No.
You tried to stop me too. But I didn't listen to you. Okay, now you can do.
Much better. Still a little bit there, but maybe we need to wait.
How much now? I mean,
Well,
you don't have to
half,
look for it.
half,
Like
of it. Maybe
half?
less than half.
So
I think.
since I modified this needle,
yes, it's
half?
yes, half of it.
so now what? 0.5 left, something
Maybe
like that,
or 1.
or 1.
Yeah.
Okay. Just- Breathe in, breathe out. Okay, now you move. Gentle. Look at me. You were doing. I'm exaggerating. But just relax. Yeah.
Shake it.
Yeah. Relax. Okay. Very good. Now you can check.
No, it's almost gone.
Very good. Okay.
Super.
This is